So in the next few lectures, I want to talk about the issue of physician-assisted suicide. Um, but in the first couple of lectures, I actually just want to say a lot of things that are kind of preparation for that. I think we need to distinguish a few different things we might mean by physician-assisted suicide first, and then we need to talk a little bit about the background of this debate. The legal and moral background of this debate brings in a lot of bigger issues in medical ethics. So I think it's good to say a little bit about those issues and the basic framework of medical ethics, which is what I'll do in the next lecture. In this one, I just want to clear up, what we might mean by the term physician-assisted suicide. Now, you guys are probably saying, how stupid is this? Of course, it's clear what we mean by physician-assisted suicide. It's a very descriptive title, right? It is a physician assisting a suicide. Yeah, okay, but I do think people often mix up a couple of different things, and the conversation isn't as clear as maybe it should be. So I just want to ward that off. I just want to say a little bit about the term to be clear what we're arguing about. So I think we should distinguish physician-assisted suicide from euthanasia. A lot of times people use these terms interchangeably. I think the terms mean something different. I'm not going to argue about you guys about what the proper definition is, but I think it's useful to have different terms for different things. So I think physician-assisted suicide is useful for picking out one thing, euthanasia another. Physician-assisted suicide, or people who are for it, often also leave out part of the term. When they say physician-assisted suicide, I think what they mean is physician-assisted suicide for the terminally ill. And, those 3 or 4 words are actually pretty important. So let's talk about both of these. So, physician-assisted suicide versus euthanasia. Physician-assisted suicide is when someone asks for help in dying and they're competent to make that decision. The person wants to die, they are very clear about that, they know what that means, and they also don't have any mental impairments that would keep them from making a competent decision. They're not suffering from dementia or Alzheimer's. They're not suffering from a mental illness. The biggest one here being depression, schizophrenia, bipolar disorder might also be issues here, right? Euthanasia is when the person isn't competent to make a decision, but another person makes a decision for them that dying is in their best interest. Someone who is severely demented or in a coma, or perhaps a very sick infant, when someone else decides, we will kill them because that is in their best interest, that's euthanasia. That's not what we mean by physician-assisted suicide. And this term's actually pretty important because euthanasia is a lot more controversial than is physician-assisted suicide. Some people who are for the legalization of physician-assisted suicide, euthanasia will be sort of a bridge too far for them. So it is good that we keep these terms separate. Now, that's not to say that euthanasia is just something that's a silly position or that it's definitely wrong. Just keep in mind it's a bit more controversial than is physician-assisted suicide. It goes a little further when we start saying not just that a person can get help in dying, but that other people can make those decisions for them. Euthanasia is a bit more worrying. Even many people who are for physician-assisted suicide start to be a bit more uncomfortable with euthanasia. Another thing to keep in mind is when people argue for physician-assisted suicide, they usually mean physician-assisted suicide for the terminally ill. Now, sometimes people will argue that physician-assisted suicide should be allowed for other conditions. chronic pain, untreatable mental illness. Some people even say if somebody just judges that their life is no longer worth living, then physician assisted suicide should be allowed there. Again, that is more controversial. Even many people who are for physician assisted suicide in cases of terminal illness will kind of throw up their hands and say, whoa, 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 I'm not for these, right? So we're going to confine ourselves to physician assisted suicide for the terminally ill. That's what I'm going to mean by that term, not physician assisted suicide for other reasons and not euthanasia. So keep that in mind as we go forward.